Hey, what's up? I'm Brandon, and this is the Daily Dope Show. And today we're going to look at the opioid crisis once again. If you're with me on this, these aren't the most popular videos I make. In fact, it seems like the least popular. Like people don't even want to watch these videos. People don't even want to talk about it whenever it's on the news. You'll see the kind of treatment it gets when I play this clip here. Yeah, we have a clip for this video. Yep. And in this clip, we have this guy, Tom Price, who's the Health and Human Services guy that Trump picked. We'll be talking for a minute, and then Kellyanne Conway will come in, and they're talking about the opioid crisis and their solutions that they've stumbled upon, I guess. And I mean, there's some doozies in there. Believe me, this is unbelievably ridiculous solutions. You're gonna love it. I mean, I'm just kidding. You're not gonna love it. This is terrible to even have these kind of people in charge of this kind of shit. And what do I mean by this? Well, let's just look. This is the guy who runs Health and Human Services. And guess what? So the top industries that contribute to his campaign or his campaign committee: health professionals, real estate, insurance, commercial banks, finance, and credit. Okay, so I mean that's a very small snapshot. Let's go right over to industries and look at what he's pulling in. Health professionals, insurance, pharmaceutical health products, and the list goes on, but hospital, nurse, homes, and a whole bunch of other stuff. Lobbyists, just a general thing here. Health, let's look at that. It's the biggest number, 632,000, just in health. PACs, they're health related, agribusiness, health. If you look at the list, isn't in order of like the biggest ones, but if you look at health, it is the second largest sector. And industries, health professional, real estate. Yeah, we looked at that. Elections, I was going to look at that, yeah. Basically, his books are pretty solid. But this is kind of a weird snapshot. But he raised these levels, the green, and then the top opponent to his campaign late. This is what they raised. And if you think about it, it kind of that's why the Democrats are so shitty these days, because they always talk about, oh, we have to take the corporate donor money, because if we don't, we can't compete with that, you know? Like the Republicans take the corporate money so they outspend us and they can win the elections. Well, if that's your argument, how come I'm seeing this fucking chart? Have you even tried to beat this fucking guy? He's the most corrupt fucker I can think of to have the position of health and human services, but you could have just ran against him with a solid campaign and maybe just beat him on ideas. But no, they try to spend money, and they don't look like they really tried that hard. He's up over here on 2008. He raised 1.6 million. Top opponent 640. And it's like, who cares about how much money you can raise? You know, look at Hillary Clinton, $2 billion or $1 billion or some shit. She wasted that much money and couldn't beat Trump. So there you have it. Tom Price, he ran. I don't know why this says 2005, 2006. Let's go right up to 2016 where it matters. Yeah, there we go. This is more like it. Now the top 5 contributors start to look a little different. That's kind of like a lot of those places are places like where he is established at himself. And on the industries, you got health professionals, pharmaceutical, health products, and insurance, top three. So, this is his campaign to where he is now. Like, he won there, and then now he's the health and human services guy. But, yeah, they gave him that much, money to rerun. And like I always say, man, follow the money. They want something in return, Don't tell me they don't. Don't tell me this is all for free. And again, the chart, health is way above everything else. So enough of that. Here's a little article I pulled. Actually, where'd it go? Yeah, okay. Yeah, here we go. So, this really quick. This is just to let you know how this corrupt shit works. Health and Human Services Secretary Tom Price had been mired in questions about his investments in the healthcare industry. This is on March 24th of this year. As it turns out, some people helping him get grounded at the department are also prompting questions about their ties with the industry. Lance Leggett, a lobbyist at Baker Donelson since 2006, was named Price's chief of staff earlier this month. In 2016 alone, he lobbied for 10 organizations, all related to healthcare. Alere Incorporated, for example, manufactures diagnostic tests and spends nearly $900,000 lobbying last year. Other clients included hospitals and Medicare trade groups, and a Medicare trade group. Leggett deregistered as a lobbyist in January. Don't you love that? Revolving door much? All right. Because he was on his way to HHS even before being made chief of staff. In the early days of the administration, Leggett was a member of President Trump's Beachhead Force, a temporary cast of characters brought in to keep the government running and lay the groundwork for Trump's agenda. With key jobs in the administration being filled at a slower than average pace, these individuals can have big impact on their agencies. In response to a Freedom of Information Act request filed by ProPublica, the names of 400 of the more than 520 members of the Beachhead teams were released by the Office of Personnel Management, including several dozen individuals who have been federally registered lobbyists. A review by Open Secrets confirmed. Sorry about my murdering of that paragraph. But let's talk about that paragraph. So you have 400 of the more than 520 members of the Beachhead teams. So this Beachhead thing wasn't just, like you have your little advisory team. It's like it can fit in a room usually, like a small room in a bunch of couches and chairs, like a dozen people, maybe 20 at the most. You're talking about hundreds of people, and these are all on some kind of advisory capacity to something or another, and they're all fucking lobbyists. It's like a fucking lobbyist, like shindig, powwow, whatever you want to call it, wherever your culture calls big-ass parties. This is what this is, man. What did Trump run on? I know Hillary was definitely the swamp, but Trump said he was going to drain the swamp. This sounds like he fucking put a big neon swamp sign out front of the White House, and basically he just took K Street. He just basically went down to K Street and said, you know what, you guys, just pack your bags and just move on down to fucking Pennsylvania Avenue. You can just move right into the White House. We'll make room for all of you. Like a fucking 400, 500 motherfuckers just kicking it. They're all lobbyists. And it's all for sinister shit, too. It is. Like this thing we're about to talk about right now. Like, these guys are supposed to be fucking doing something about this opioid epidemic, right? More about, this article's pretty good. It just tells you more about this revolving door bullshit. And And here's a big list of some former lobbyists on Trump's beachhead team. Consumer Product Safety Commission, Department of Labor, Department of Housing and Urban Development. I mean, if you look at where they lobbied for right before they got the job, it relates, it lines up. Department of Energy, lobbying client was Family Research Council. Family Research Council is a highly right-wing, like crazy people that, tell you that we need more oil and we need more natural gas, we need coal. That's what they tell you. It's a Koch brothers funded thing. We got Department of Veteran Affairs, and their lobbying clients include Florida College at Jacksonville, Valencia Community College, as well as Lockheed Martin, Radon Corp, and BAE Systems, BAE Systems. Most recently, he was executive director of a group called Military and Veteran Caregiver Network. So, you got somebody that was working for a bunch of people that lobbied for the VA to probably do whatever, sell products, services, whatever. This is the kind of shit, like Secretary of Defense, the client was lobbying for Plantier Technologies. You look that up, what is it? I don't know. I'm looking it up at Open Secrets. It's probably not the best place to look shit up. But you get the idea, man. This is some revolving door swamp style shit. So total swamp from head to toe, holy fucking swamp. And without further ado, let's get into the video. And by the way, like, I didn't really pick this video for any reason or whatever, but after analyzing it, what I will say is this is exactly how the opioid crisis in this country, where more people are dying every year than have died in the fucking whole entire Vietnam War. All right? If you look at the war in Iraq, I think we're up to 5,000 people that died in Iraq that are American soldiers. Just Iraq alone. Times that by 50. That's how many people die every year from the opioid crisis. And all these people are always constantly convoluting the numbers and calling it the drug crisis and saying that it's something, that it's like a broader thing than just an opioid crisis. They're trying to muddy the waters, and you know what it is. It's because they want to throw weed in there with it. Weed ain't fucking killing people like daily. Weed isn't causing babies to be born every 20 minutes, or I don't know what their numbers is here, but I think it was every 17 minutes. But whatever. Every 17 minutes there's a baby born addicted to opioids. So, there's a whole bunch of shit to be said about the content of what you're about to see, but just look at how it's framed on CNN. You're going to see Jake Tapper. They're already talking about North Korea, and they can't stop talking. They can't, this is CNN and the mainstream media. All they do is beat the fucking war drum. And if you can't hear that, then you need to fucking unplug your TV for at least a week and then plug it back in and watch the war drum. It'll freak you out. Like, that's all they're doing is trying to manufacture consent to nuke North Korea. I don't know, whatever that is. I don't watch TV, so I have no fucking idea. All I know is I went on Facebook, and everybody on my fucking timeline is like, oh my God, we need to nuke North Korea or bomb him, or we got to stop him before he nukes us. Dude, this little fucking twerp in the middle of nowhere with a bunch of starving people that he's got to, like, present this God image all the time. He ain't about to nuke us. What? He's afraid right now. No matter what he's projecting to his people or acting like he's threatening Guam or some shit. Come on, give me a fucking break. This guy is pure bullshit, and he's scared to fucking death. He's probably a little suicidal, but he's definitely scared as fuck. He's definitely pushing his thumb into the most ridiculous war machine. I mean, we don't even gotta, like, act like anything happened to take over North Korea. Are you fucking kidding? And nobody's gonna stop us. Not after, like, these provocations. So I don't see what the fucking story is there. But, alright, back to what we were talking about. Watch how this goes. They're cut in, oh, we got to talk about this goddamn opioid bullshit again. And then afterwards, same thing. Oh, well, fuck the opioid shit. Sorry if you guys want to hear the rest of this press conference, which I kind of did because they were about to say some more bullshit that I wanted to jump on. But whatever, we'll just take what we can get.
Hold on one second. Here is Dr. Tom Price. Jamie, stay with us. We'll get to that later in the show.
We just have come from an extremely productive meeting. The President and the First Lady gathered to talk about the opioid crisis. The President and First Lady are absolutely fully engaged on a tragedy that is crossing the country. The President understands the magnitude of this challenge, how devastating it is, how it's devastated individuals and families and communities, large and small. He understands the effect that it has had on our nation, especially on families and on children. The numbers are absolutely daunting. 52,000 overdose deaths in 2015, 33,000 of those approximately related to opioids.
Let's stop you right there. All right, now, what he just said was that there's 52,000 deaths from this drug epidemic. Let's run that back a little bit.
2015, 33,000 of those, approximately 52,000 overdose deaths in 2015, 33,000 of those approximately related to opioids.
Are you trying to tell me that there was like 21,000 some odd? His numbers are still a little bit not registering. 52, 23. One more time. Fuck.
33,000 of those, approximately 52,000 overdose deaths in
5233. So he's trying to say that there was some 19,000 deaths that were something other than opioids. No, man. Those deaths are all opioids. Some are heroin. Some are fucking opioid synthetics. That's the number that we're dealing with. What is he trying to do with this convoluted bullshit?
2015, 33,000 of those approximately related to opioids. The numbers in 2016 are no better.
No, and we're on pace in 2017 to reach the 60,000 or more mark. So what in the fuck are you guys doing about this shit? Nothing. Not a damn thing. You got Christie and I for some reason the name slips my mind, but he's got his team of experts are really working around the clock to figure out ways to set up rehab clinics all over the country for people that get caught using marijuana.
And the numbers in 2017 are even worse than 2016.
You better believe it, man.
So
you guys are demonstrating that you don't know anything, or you don't want to do anything to try to stop this shit. Damn. And I'll show you in a minute exactly what they're not doing.
Brief the President on our strategy through Health and Human Services Department, a strategy that includes making certain that we have the resources and the information necessary for prevention and treatment and recovery, providing best practices for states and those that are engaged in that process, making certain that we have overdose reversing medication, naloxone and Narcan.
Because what they're trying to do is they're trying to raise the price on those. They've steadily been raising the price on both, and if they can get the price where his donors want it, then that'll be fine. They can basically make rules so that police departments and fire departments and shit like that can just get it paid for from their state budgets, or the federal government will kick them back some credits or something to help them pay for it. They're basically about to sell you on all the ways we're going to fucking help this heroin and opioid crisis is all pharmaceutical related. Just here we go.
As present as needed and possible anywhere across the country. Making certain that we're doing the data, identifying the data, the public health aspect of this. Why is it that 52,000 Americans succumbed to an overdose death in 2015.
Because you're overprescribing opioid pills, and you're letting pill manufacturers and synthetic opioid manufacturers manufacture shit loads more opioids than what is needed to be distributed legally, or even legally, with this extra prescribing and overprescribing shit going on. Even with all that, there's still just warehouses full of fucking fentanyl, warehouses full of OxyContin, warehouses full of hydrocodone, whether it be Vicodin or whatever the fuck. Morphine. Just, you basically let these guys stockpile and manufacture just ridiculous amounts of opioids. That's the whole problem. And they're just fucking trying every way they can, under using the word marketing to do all kinds of weird shit to basically get rid of all these opioids, and making billions of dollars doing it. Anyway.
And those numbers continuing to increase. Fourth is the research aspect of this. What is the NIH doing? What can they do?
I'll tell you what they're doing. They're fucking cock blocking. One of the tools you could use to help in this epidemic is cannabis, medical marijuana. And I'll get into this throughout the whole video probably, but with medical marijuana, you can start people who have chronic pain on a medical marijuana regimen, because that's going to be better in the long run overall, and for many reasons. But one of the best reasons is that you're never going to die from an overdose of fucking opiates if you use cannabis for pain. But another reason that they should be looking at cannabis as a tool in the shed to help with this opioid crisis is because it can help people who are addicted get off of the fucking opioids or the heroin, either way. So you guys gotta stop being this stupid. But of course, I know why. It ain't that they're being stupid. They're fucking smart. They don't want anybody to get better. This guy has been involved with the healthcare industry his whole life. It wouldn't be an industry if everybody got better. The worst fear of the healthcare industry is that nobody's going to get sick, because they use getting sick as a fear for you to buy insurance. It's a big fucking racket, in case you haven't figured that shit out. And this guy is just one of those snake oil salesmen who's going to fucking sell you snake oil on everything and it's a cure-all, here you go. Let's see how they're going to take care of this opioid epidemic.
Kind of exciting things to provide for, hopefully, a pain medication that is not addictive.
All right. They've been talking about this so-called pain medication that is not addictive just about as long as they've been talking about marijuana being the fucking reason why black guys want to rape white women or some shit. This is just the same snake oil that anybody out there is going to fucking try to sell you, when there's actually something like marijuana that is a pain medication that's not fucking addictive. And with marijuana, when I say not addictive, when you got a pain medication and you're using it for pain, you don't want to have to take it every fucking time you wake up. You don't want to have to take it every day, 2-3 times a day, because then it starts not really working that good. You have to take more of it, and that's not healthy either. But with cannabis, it doesn't even matter, man. Just smoking a little bit of it every day, you won't even really have as much pain as you normally do. And let alone wake up feeling like the world is crashing down on you if you don't get your fix. Come on, man.
Or is not euphoric. One of the exciting...
Not euphoric. You're going to make a pain medication that knocks out the pain, but it's not euphoric. Once again, I'm thinking CBD might be your answer. But, you'll never say that. You'll never fucking say that. You right on the other side of your, block where your building is located that you're at is another organization that totally doesn't want that to happen. So that'll never happen. They're arresting people for CBD still.
Things that they're actually working on is a vaccine for addiction. All
right, vaccine for addiction. That sounds very ridiculous. Are you fucking kidding? Now, what is this even about? A vaccine for addiction. Now, first of all, what addiction? A vaccine for an addiction makes it sound like this thing is like specific, because in the world I've observed in my 45 years on this planet, addiction is kind of like a disease. It's like an affliction. It affects your mind, it affects your emotional state, it affects your like physical well-being, and like if you don't get your fix, you might not be able to actually fucking get out of bed or some shit. Like addiction it's a disease, man. It's not just something where it's like, okay, I'm gonna like take this vaccine and I'll never get that nasty bug where, yeah, they act like, you got some kind of a magic bullet. Not, to me, the pharmaceutical industry lately is really reaching. I mean, they're going for bust. They're like, look, man, we're going to come up with a way to, make it so, like, you do this vaccination, and we can make it, all you got to do as the government is make this mandatory, so everybody has to get this vaccination. But it's not like when you're a baby, because when you're a baby, they got too many vaccinations that you got to get done. How about a vaccination that you give it to them, kind of like sometime before you think they're going to start doing drugs. And for some reason, it's going to make them like not do drugs. Because, addiction is just drugs, right? Addiction is when someone does heroin and they're like, oh, I got to do more of that. That's the best shit ever. And, it has nothing to do with a person's like state of mind or well-being or economical situation, or, addiction has so many other factors that play into why it is a thing. There is no fucking way that you're going to tell me that you're going to come up with some kind of vaccination for addiction. And if you fucking, obviously you're just sitting there with a bunch of laboratories and, scientists and doctors and shit and people ready to do the trials for the FDA. All that shit's just sitting there waiting for you to be able to say, yeah, let's get some funding over here to try to do the research on how we're going to make a vaccine for addiction. And then once they come up with one that we approve, we'll make that shit mandatory. That you're going to have to give it to your kid by the time they're at least like 10. Most absurd thing I think I've ever fucking heard in my life. A vaccination for addiction.
Which is incredibly exciting.
Oh yeah, it's incredibly exciting. A vaccination for addiction. It's incredibly exciting how much money you're going to see falling into, just stealing money from the government. Like, okay, government, throw all this money to all my friends that just donated to my campaign. We're going to find you a vaccination for addiction. You know what? I wish they'd find a vaccination for addiction for fucking politicians' greed for money. That would help a lot. That would help us out a lot. We wouldn't be in the fucking mess we're in right now.
Prospect. And then finally, how do we treat pain in this nation?
With cannabis.
As a formerly practicing physician, orthopedic surgeon, I know that physicians and other providers have oftentimes sensed that there is an incentive to provide narcotic medication. And we need to do all that we can to make certain that, yes, people are provided appropriate narcotic medication when necessary, but no more than necessary.
Okay, now when he's saying narcotic, if you look up narcotic, marijuana is not involved in narcotics. Narcotics and marijuana is considered a psychedelic for some fucking reason. I mean, maybe I get it, maybe I don't. It is a tetrahydra, so that alone is in a class of psychedelics of its own. But whatever, like, I've heard it classed as a depressant as well, and I've also heard it being classed as a stimulant. So I guess you have all three. Anyway, yeah, there's really no reason to act like, what you're trying to do is go after the patients. I mean, I can't really look at it any other way. You're like, well, what we really need to do is figure out this whole pain management thing. And it looks like we fucked up before when we were like, yeah, why don't we just make it so if if you have pain, you can just go get endless Vicodin scripts. And if you got to get, that Vicodin didn't work good enough, we can bump you up to oxys. If that shit don't work anymore, we got fentanyl patches, morphine, liquid this, dilaudid that. And next thing you know, it like your insurance runs a scam on you, or you don't, you can't pay for it somehow anymore. And heroin guy comes around, he's like, dude, shit, I got this shit here. It's a lot cheaper. And next thing you know it, man. When you go after the patients, that's another thing. I heard this other guy talking about, we're going to send some more federal prosecutors out to where those states where the opioid epidemic is really bad. I mean, what's that going to do? Who are you going to go after there? Are you going to prosecute a bunch of doctors and patients and shit? That doesn't make any fucking sense. So yeah, these guys are going after, they're using a freaking a boulder to hammer in a thumbtack or something. I don't know.
We wanted to make certain that the president understood that it was his entire cabinet and the federal government that were involved in this process.
Yeah, I already read that whole, what was that, the Beachhead group or whatever? Yeah, that cabinet there, is that the one? Like the fucking 500 lobbyists?
This is an interdepartmental, interagency process.
It sounded like it. You had over 400 lobbyists. That couldn't have been all one agency.
It's moving forward. We've met previously with the Department of State, Justice, Department of Homeland Security, ONDCP.
Wow, you met with all the cops and the Office of National Drug Control Policy. All the cops and all the policymakers.
And others to make certain that we're working together on a comprehensive strategy.
Sounds like a bunch of cops and a few doctors and the people that set drug policy. And no talk about setting some new drug policy on cannabis, which has been proven over the years. And I mean, it's been legal medically in California for decades now. I mean, for real, come on. So we know now that like 90% of all medical marijuana recommendations are written for pain management of some sort. And 90% of those people say they're satisfied with it. 3 out of 4 people when asked, would take medical marijuana before opioids if they were diagnosed with some kind of chronic pain. So whatever you're fucking smoking, chief, you're way off on where we're at with pain management technology. And we're talking about cannabis. What are you fucking talking about?
That we're in the midst of right now, and that we will be presenting to the president in the near future. At the end of all of that, the president...
Basically what he just said is we got all the scammers together to scam and try to figure out all the scams that they can work out to scam you, and then we're going to start scamming.
The president made certain that we understood that he was absolutely committed to making certain that we turn this scourge in the right direction.
And I feel sorry for Trump because I don't think he's the bad guy in this, just like a lot of things going on in the fucking government these days. It's always these corrupt as fuck politicians, and most of them, the lion's share of them, like 98% of them are Republicans that want prohibition to continue, if not reverse the fucking legalization that has already happened. I'm not talking about just your regular old everyday Republicans. I'm talking about the hardline, anti-drug, pro-pharma, pro-incarceration, anti-healthcare. I mean, this guy, he's been working in healthcare all of his life. And he's all about getting rid of Obamacare, which I'm not a big fan of, even though I got a free insurance from it at one time. And I don't know, I mean, you can say what you want about Obamacare. It's better than what the Republicans are trying to propose. And that's all I'm going to say about it, other than all of it is just a big giveaway to the fucking insurance companies, which we don't need. If the insurance companies really cared about your health, everybody would be covered. I mean, even if it was just like, hey, just give me your change after you pay your taxes or something. I don't know. insurance companies make the system of health insurance in America a predatory system that relies on, people, like being healthy, paying into it, which doesn't happen. So the people that are really hurting, they're the ones that are going to end up hurting. I'm getting sidetracked.
Turn this tide in the right direction. Make certain that we see the number of overdose deaths and the number of individuals addicted to medication decreased. He has made certain that we understand and appreciate that this is an absolute
Trump's
priority of his administration, as it has been from day one.
Idiots.
One of the things that we've done to try to bring a voice to it and bring faces to it is to go around the country in multiple states and to visit communities and try to find those best practices, what's working out there, what hasn't worked. Talk with those families that have been...
All right, first of all, wait, let me finish that sentence.
...and devastated by the addiction crisis.
All right, first of all, you said we're going to go out there and listen to the communities where things have turned around and see what worked. First of all, you got to find one of those communities where things have turned around, because I don't know, I haven't heard of any. If you know of one, let me know. We've had whole states show numbers that are significantly turned around. That's called the medical marijuana legalization movement that started in California decades ago. In every state that has been legalized for medical marijuana, where access is good, what you have is lower prescriptions being doled out to, and this is a study done by people that get Medicare, so they know the exact numbers, and I don't know, it was just because they can really look at those numbers, but overall the prescriptions for opioids was down. And the actual pills given out was down 20 to 25% in some cases. And furthermore, opioid overdose deaths in those medical marijuana states with good access had also seen decreases anywhere from 10 to 25% as well. So you already have places where you can demonstrate that it has worked. And then when you say that you want to hear directly from the families that have went through this crisis and done this and done that and seen something that worked and helped them get out of addiction. Well, I believe you had this commission headed up by Christie that ignored 8,000 cannabis letters from people that gave testimony or had some kind of a story directly about, the crisis. Now, there's some kind of contention to that. The only contention I've heard is that, they were form letters, which is a big deal. Even that being said, the person that reviewed them on the other side was like, yo, yeah, but everybody added something to it. And it was like you could sit there all day and read about people's stories about overcoming addiction, using cannabis for pain management and not actually getting addicted to opioids, but just getting out of their pain, the pain that they were in at the time, like got a tooth pulled or something like that. I mean, we're literally getting people addicted to OxyContin and hydrocodone right now just because someone gets a tooth pulled or sprains an ankle or some shit. That's how overprescribed this country is. Like, and it's not even that, it's over-manufactured. We still haven't got to that point yet, though.
Talk with folks who've been addicts and have recovered. What is it that worked? It's so uplifting
cannabis.
And inspiring to hear the stories of
many
of those individuals.
Those ones.
One of the president's senior counselors, Kellyanne Conway, has accompanied me on many of those trips, and she was at our meeting today, and I know that she wants to say a few words as well.
Kellyanne Conway.
Thank you, Secretary Price, and it's very nice to have the acting director of ONDCP, Richard Baum, with us today as well.
And there's Baum right back there. Remember him? He's that guy that sat there and took those bullets from Gowdy and Connors or whatever. And he still looks like he's on some kind of crack or meth or some shit. I mean, I'm no expert, but this guy just never looks like he's not like totally fucking like tweaking.
The secretary and I have traveled to a number of different states, and we have heard the harrowing and very sad stories, but we also have increasingly met those who have successfully gone through treatment and recovery. We're very heartened to learn many people who are beating the opioid epidemic, and we recognize this is a poly-drug problem in our nation.
When you say that, you're taking so much away from the fact that the only thing that's killing people in a like frighteningly, alarmingly high rate is the opioids. This isn't people dropping dead from cocaine. This isn't people dropping dead from crack. This isn't people dropping dead because they didn't drink enough water while they're tripping on Molly or some shit. This isn't marijuana killing anybody. So why do you hold this up? Why do you hold us all back from just saying that? It's like when Obama was around and all the right wingers were like, oh, he won't say Islamic fundamental terrorist or some shit like that. Like he didn't want to admit that we had some kind of problem. Well, here you guys are doing the same shit at every turn. You want to say, oh, 33,000 of them were opioids. Yeah, well, what about the other 20,000 or whatever heroin deaths? Now you're not even trying to admit that there's more people dropping dead from the opioids than the heroin in some cases. In a lot of states, that's the way it was. But, you know, these people are just going to keep selling you their snake oil. Just watch.
That we are a nation that consumes legal and illegal drugs at a very high and alarming rate. The problem is very complicated, and currently we're on the losing side of this war.
Yeah, you're right about the consumption. America consumes 80% of the world's opioids. 80%. Don't you think that's bogarting? We're only 5% of the population of the world. So what's this 80% of the opioids? I think the cocaine is up there like 70% of the cocaine. But the opioids, the 80%, isn't just the heroin. It's all the opioids, all the fentanyl, all the Vicodins, you name it.
With the President's leadership and the First Lady's involvement across a spectrum of different cabinets and agencies and different departments within the West Wing, we are confident that we can help those in need across this country.
That's pretty scary.
We know that this involves public health, the medical community, healthcare delivery system, law enforcement, education, local and statewide elected officials, devastated families, and those in treatment and recovery.
Notice how when Republicans are talking about this shit, and sometimes Democrats too, the treatment and recovery thing is always the last thing on the list that they give a fuck about. Law enforcement's always up there on the top. Like, there's always a way that law enforcement's going to solve the crisis, the drug problem, the this, the that. She might as well have threw in church on that list, because that's just like always the Republican list of ways we're going to fix the drug problem. It's fucking bullshit, man. The way you're going to fix the drug problem is to stop the prohibition of drugs, admit we have a drug problem, and then fucking do something about it. Treat it as a public health problem, and yeah, get rid of the black market. There's only one way to do that. We'll see. You've seen it with marijuana in Colorado. That's how you get rid of the black market. I mean, if anything, you turn the black market into something that's a little bit more manageable for everyday people, instead of some kind of a chaotic, place where potential murderers are lurking around every corner and whatever, selling everything under the book in one location.
We have presidential imprimatur and leadership on this issue, but we full well know that most of the great work is being done at the state and local levels. Those who are closest to those in need know best how to help them. We didn't get here overnight, and we know that we can't solve the crisis overnight either.
We didn't get in here overnight. It was started, Purdue Pharma really kicked it off big time, like 25, 30 years ago, 20 years ago, whatever. But yeah, the current crisis we're in, we've got here pretty much overnight. And it wasn't some poly drug problem where every drug under the sun was abused more than they normally were. That's not what's going on. That is not what's going on. In fact, alcohol is going down. Tobacco is going down. Even coffee is going down. Cocaine use is going down nationwide. All the drugs are going down nationwide except the opioids. For some reason, oh my God, they're the ones going up.
That said, I'd like to bring attention to some other areas with respect to the opioid and drug epidemic that sometimes go uncovered. With a 52.7% increase in outpatient veterans treated for substance abuse disorders from 1995 to 2013, it's an increasing concern that addiction is plaguing our veteran community as well.
And what have they been asking for the last 10 years? They've been asking for medical marijuana to treat PTSD. So it's your fucking fault for not doing it. It's Obama's fault, and now it's your guys' fault. All you have to do is say, yeah, the veterans can have medical marijuana for whatever, pain, PTSD, whatever. I mean, the more you look at the pain thing, the more that's the whole problem with this whole opioid epidemic is that they didn't really have marijuana or medical marijuana or cannabis or whatever you want to call it. I call it Simpson oil. They didn't have that on the table. The doctors still don't act like they got that on the table in places that has good medical marijuana programs. They'll steer you around that shit if they can, because they don't make money off of that. But, you know, since they're not going to ever push that narrative, even when it's totally acceptable, as long as these big pharma fuckers are influencing the government at the level that they are now.
We're working with Secretary Shulkin on that. The next generation of the crisis is being seen in the number of newborns that are born addicted to opioids and other drugs.
And there she goes again with the other drugs. What other drugs are the babies being born with? That's just, you're just adding that shit on there. I mean, I'm sure there's other drug. I'm not saying that it's not happening at all, but I'm just saying that that's not what the epidemic is. The epidemic is that every so often, and she's going to give a different number than I've seen, and the number I've seen was every 17 minutes an opioid-addicted baby is born. That's fucking tragic. That's the craziest thing about this whole epidemic that no one talks about. Forget about the fucking 60,000 deaths this year that's going to be tabbed up.
In fact, in this country now, NIH estimates that every 25 minutes a newborn is born addicted to opioids. We are working hard to also stop the import of fentanyl into this country and to work with those governments.
Why would you have to worry about the fentanyl that's getting imported into this country, which is probably something, because everybody's probably trying to get a piece of this market, and focus on the fentanyl, the extra fentanyl that's produced by Big Pharma in this country? And it's all the opioids, not just fentanyl. It's all of them. They're all being overproduced, overprescribed, even overproduced beyond what is prescribed. And somehow it still leaks out on the streets. So, I mean, obviously, you might be able to actually cite some cases about some fentanyl coming in from overseas or whatever, but you're basically saying China's making fentanyl and just dumping it on America. That's just not the case. How can they dump something on somewhere that's already got completely dumped on already with that some said substance? Which in this case is fucking fentanyl. America has like 4 or 5 companies just cranking that shit out on every form you can think of.
Governors and health commissioners and others within the states who are interested in reducing the number of pills and days in a prescription, and also
again going after the patient
in working with the curriculum so that our medical professionals are more educated and more conversant with and versed in prescribing methodologies as well.
Last time we seen or heard you guys say you were going to do something like that, it just turned out to be another big scheme where you kind of like fucking figured out ways to dole out more pills. So I don't know if I believe any of this horse shit.
President Trump and the administration are working tirelessly toward this, and I would just say that having traveled this country and studied this issue very closely, no state has been spared and no demographic group has gone untouched. This is not a problem of young or old, of black or white, of rural, urban, or suburban. It really has affected all of our communities in varying degrees.
That's why they love it. They don't care about human life anymore, guys. The donors, the governor, the actual politicians, these counselors to the president that we got to hear on fucking TV, the people that do the fucking reporting on the TV, none of them give a fuck about us, guys. They all live in this big imaginary bubble where we are just numbers and statistics. When they do a story and go and talk to individual people in the situation, it's just really just weird. Because to me, it's just them like breaking out of their bubble and going down to the peasant level and like, prodding the fucking, beehive and seeing what flies out of it. They're not trying to do anything about this current situation. They would like to slow the deaths down a little bit, but to them, this is all going just according to the plan. And if Big Pharma really cared about it, which they don't, all they want to do is make more pills and sell more pills and make more money.
It is also a nonpartisan issue in search of bipartisan support and bipartisan solutions.
I don't know if you're all fans of George Carlin, but I know that when George Carlin said, whenever you hear that they're coming up with some bipartisan solutions to something, get ready to get fucked extra hard.
And we do hope that those in a position to help with the decision-making and advocacy and solutions, and those charged with covering this issue as well.
Those charged with covering this issue. Well, let's see. You're talking about the news channels like CNN and all those fuckers? They don't want to talk about this shit ever. And, all you got to do is just, watch that shit for 1 hour and you will have seen, 30 or 40 fucking big pharma commercials or healthcare commercials in general. So, come on, man. If you think that you got some honest reporting about anything to do with the opioid epidemic coming out of fucking any of the mainstream media, you're crazy.
We'll agree that it is nonpartisan in search of bipartisan solutions. Thank you very much.
Scary.
Happy to take a question or two, yes?
Secretary, a couple of questions. Several attorneys general, including some Republicans, have said
that you should really fucking start thinking about medical marijuana as a solution or tool in the shed of solutions to get your ass out of this bullshit problem that you definitely love swimming in the middle of, you corrupt bastards.
Manufacturers of opioids should be sued.
Yeah, they should be. And they should be, if you caught somebody manufacturing too much marijuana in one of these regulated states, the fucking cops kick the door in and take all the equipment and all the shit and all the everything. This ain't some kind of thing where just some regulators come by and are like, oh, you didn't pass an inspection, so we're going to fine you this much money, because they see how much extra shit you're doing. So they're like, I'll just give them this kind of fine here and it'll work out. Whatever, man. The way it works right now is nothing like the way that they're getting over here at Big Pharma. So what is this?
And are culpable or should be legally culpable for parts of this crisis.
They got caught over manufacturing and warehousing pills in the middle of Ohio. OxyContin is just stacked up to the ceiling in a warehouse. Where were all those going to go? The population of the town wasn't even 1/100th of the amount of pills that were in that warehouse.
Do you agree with that? What's the administration's orientation to those lawsuits?
Well, there are a couple suits that are out there right now that have already been begun. I think that this gives...
In fact, several states are now suing Big Pharma for multiple offenses.
Voice and punctuates the damage and the harm that people have felt because of this crisis.
Your donors are pissed. They're getting
there isn't a position that the administration has on these suits at this point, but it has clearly gotten the attention of the pharmaceutical companies.
You mean your they got the attention of my donors? Yeah, they're fucking pissed.
Some have analogized it to the
like, where are we going to get the bribery money from if these guys keep getting sued like this?
Tobacco issue and the master settlement that occurred. I don't know.
There's going to be no master settlement. No way. We're going to sue Big Pharma down to where they're not Big Pharma anymore. I wish we could do that to the big banks too, but I don't think that's possible.
20 years ago with the issue of tobacco. Whether this is something that's analogous to that, I don't know. But it's... Well, what I see is that there is... that we continue to move in the wrong direction on the number of individuals that are not only addicted, but the number of individuals that are losing their lives to addiction. And so the president is absolutely committed to solving that problem, and we are going to turn over every...
I think they got this teleprompter set to where it just like tries to put some filler in. So I've heard him say these repeated lines at least 3 times now.
Every single rock and make certain that we're identifying every single thing that could move us in a better direction.
You didn't turn over every single rock and move into a better direction by ignoring cannabis. Again, I just have to be a fucking stalwart. I just have to be a stickler and be like, dude, you keep saying that you turn over every rock. Let's hear that again.
Committed to solving that problem, and we are going to turn over every single rock and make certain that we're identifying every single thing that could move us in a better direction.
You're full of shit, Tom. You know you fucking are full of shit right there, because cannabis, as 8,000 comments came and said, could move you in a better direction. I mean, the comment I made was simple. Like, you could just prescribe people medical marijuana of some sort, like just smoking joints, for example. You could just prescribe that to people. You already do. The government already gives some people that in Florida, 2 people in Florida, like 300 joints a month. You could just prescribe people cannabis, and that would be a better outcome for your fucking pain management situation. For all you would have way less people even getting into opioids.
Well, the president certainly believes that we will treat it as an emergency, and it is an emergency. When you have the capacity of Yankee Stadium or Dodger Stadium dying every single year in this nation, that's a crisis that has to be given incredible attention, and the president is giving it.
All right, so but you act like it's an emergency. I've heard that floated around, like when somebody finally uses medical marijuana, or they finally, well, our kid has seizures and we tried everything else. Or, leukemia. We've tried everything. We don't want to see the kid die. He's trying to fight so hard. And then they finally say, well, we tried everything, and then we were like, fuck it, let's try marijuana. Like it was so bad. Dude, everything else you tried is toxic, if nothing else. If the kid took too much of something that could actually kill the kid. Whereas cannabis is not toxic, so that would never happen. So you don't think that in the emergency that you're in, that you should look into the fact that cannabis can help this crisis in 2 ways, like I keep saying. I mean, this must be the theme of this fucking video. Like, A, it can help fight addiction for people that are already addicted, and B, for real, it can help you by not even ever prescribing people opioids in the first place.
That attention, yes,
Mr. Secretary, thank you. I was curious, those of us old enough to remember the crack problem 20 plus years ago, how is this different, and how is the approach to deal with the opioid problem going to be any different? And are we just going through a cycle of a new crisis every 20?
Can I answer that real quick? The difference between this and the crack epidemic is that the crack epidemic wasn't manufactured by opioid manufacturers who basically churned a bunch of doctors and marketers loose with shitloads of opioids and got the whole country hooked on them. Crack epidemic was totally different. If you believe what I believe, the CIA brought the cocaine back from the Contras in Nicaragua, and when the cocaine got here, there was certain agents, Nicaraguan dissidents or what have you, people that were part of the inner circle of this drug ring that the CIA, quite frankly, ran, and they fucking taught people like Free Ray Rick how to rock the shit up so it's back to the base form and sell little rocks. That's how the crack epidemic happened all across America simultaneously. Ain't that weird that simultaneously, they didn't have the internet back then, mind you, all of a sudden everybody from coast to coast just knows how to cook up crack. It ain't like there was like, it wasn't in the fucking, what do you call it, the anarchist cookbook. That was basically the only thing you had back then to like try to figure shit out. Besides the grow guides and the mushroom book. So anyway, he's not going to give any love to that.
Years and the public forgets. I mean, what's different here?
Well, it's different for a number of reasons, not the least of which is the magnitude and the numbers of individuals.
All right, there
succumbing to
the Secretary of the Department of Health and Human Services, Dr. Tom Price, and Senior.
Of course, that's how they handle this, thing. They basically, that's how they handled it at CNN. And it's like, oh shit, this is in the way. We got this North Korea drama to fucking keep beating into your head. And it was just a little side story. But, let's just go back to what the last thing he said was. He was trailing off.
Of a new crisis every 20 years and the public forgets. I mean, what's different here?
Well, it's different for a number of reasons, not the least of which is the magnitude and the numbers of individuals.
So the crack epidemic didn't have as big of an impact because of the sheer numbers of individuals
all right,
succumbing to addiction. Dying. The number of individuals dying from addiction. With crack epidemic, you had a lot of people that were going to prison over it. And they were getting ridiculous 20, 30, 40-year-long prison sentences. So that's the real difference I see. In this epidemic, not too many people getting arrested for, like, slinging fucking Oxycontins or fentanyl mouth spray. Not too many people going, to jail for that. But on the crack epidemic, you had people lined up on the docket, like 10, 20 of them a week, for crack sales or crack possession. So there's a lot of differences. But the one he said, the difference in numbers and the difference in sheer like deaths, the difference is the reason why Republicans are caring about it and talking about it and tell me if I'm wrong, is because some of the hardest hit places right now for this opioid epidemic, and when I say opioid epidemic, I do mean that more people are dying from the pills and the synthetics than the actual heroin now. It's been that way for a while. It kind of fluctuates here and there, but these people are white. They live in rural areas in Ohio, West Virginia. Then you got city areas like Boston. There's quite a bit of white people that are addicted in the Boston area from what I've read. So when you talk about white populations versus, say, black populations, you're talking about massive amounts of more people. So when you're saying, okay, how many people in the white community in a place like Boston might be addicted to opioids, like synthetics or pills, hydrocodone, all the way to morphine or whatever, fentanyl, carfentanil, for fuck's sakes. And it's a lot. There's a ton of people. That's why people are dying all the time. So that's why these people here are caring, especially Republicans. They usually just like lock them up. Drugs, what? Lock them up. That's usually where they're at. But now they're kind of taking this different tact. Like, I know we got law enforcement at the top of the list and all this other shit, but somewhere in there we want to put treatment. We got to start acting like this is a problem. that everybody has. So what did Jake Tapper do? He came in and was like, all right, shut the fuck up, guys. We're going to get back to the drama we were already doing. Sorry if we killed your buzz with this stupid-ass opioid bullshit.
I mean, what's different here?
Well, it's different for a number of reasons, not the least of which is the magnitude and the numbers of individuals
all right, there
succumbing
were
to addiction
the
and
Secretary of the
losing their
Department of Health and Human
lives.
Services, Dr.
This
Tom
is-
Price, and Senior Counselor to President Trump, Kellyanne Conway, talking about the opioid crisis in this country. They're going to...
All right, that's all I got. If you like my videos, please subscribe. Come on now, why wouldn't you? If you made it this fucking far in this video, shit, you should subscribe. I would, because I do this shit a lot.